question. So are you addressing Narro as the former health minister or the current UNAM director?
Good evening. Good evening. It's 7:01, Friday, May 8th, 2020. We're in the National Palace in Mexico City, and we're going to start our daily press conference on the COVID pandemic caused by SARS-CoV-2. We're going to focus on two elements today. First is the technical report, and then we have our very beloved and dear Dr. Claudia Sheinbaum, Governor of Mexico City. She is here to talk to us today about mortality, records, epidemiological monitoring, and a number of technical aspects that we think are important. We realize that there are some doubts. Some people have doubts about this. So before we talk about the technical aspects that we talk about many times, but we want to tell you that we always welcome new questions. Governor, thank you. Dr. Alomia, could you please present the technical report to us, and then we will hear from Dr. Scheinbaum. Good afternoon, everyone. Let's start our daily technical report. We are here at our nightly conference. Tonight is number 70, and we are continuing with our Susanna Safe Distance campaign. Let's take a look at the international context, which is over 50%, 51.5% exactly. The cases confirmed in the Americas in the last 14 days. This represents the active pandemic in our area. This is the total cases over the last 14 days, 31%, a little bit less than 2/3 of the cases that have been confirmed up to now worldwide. We have an update here. These are our national updated numbers. We have 1/4 of these cases that are active. This is the active pandemic in Mexico, 8,048. Then we have 3,160 very unfortunate deaths and more than 123,000 people who have been tested. They've been tested for COVID-19, and 71,000 of them have been negative for SARS-CoV-2. Here we can see the burden of disease are 31,022 cases. We can see here how they are distributed over Mexico. As you can see, based on our color scheme, you can see the range of confirmed cases. Each state is colored in with their burden of disease. We see the same information here, but represented as a bar graph so that you can see the totals for each state. And we must highlight that the highest burden of disease is in the states with the highest population density. Here's the map again, but just with the active pandemic. With those 8,048 cases, you can see that some states that have more than 100 cases have a darker color on the yellow scale. Here you can see the information presented as a bar graph so that you can see exactly what's going on in each state with these numbers. Here we have the cumulative caseload by 100,000 inhabitants. We have the national numbers, which are 6.29% per 100,000 inhabitants. And you can see the darker color scheme representing where we have a higher number of cases per 100,000 inhabitants. Here you can see that same information, but presented as a bar graph going down by state. This is the incidence rate, the cumulative incidence rate per 100,000 inhabitants. This is distribution of deaths by date of death. 3,060, 3,160, and then 254 suspect deaths, which have not yet been confirmed as COVID in a laboratory. You can see with this graph that the blue are the deaths and the yellow are the suspect deaths. Just like you'll be able to see on the next graph, here it is by state. Again, the blue representing deaths and the yellow, the suspect deaths. And you can see where these deaths have been concentrated, in what states, and you can also see at what hospital they died. Here we can see the pandemic curve. We've been talking about this over the last couple of days, that we've seen that increase in the curve. The curve is getting higher, it's getting bigger. And this is a trend that we hope will continue to show us the burden of disease in Mexico. We can also see the burden of disease confirmed in the whole country. 6.4% is the increase from yesterday to today. And that is for the 1,906 new confirmed case. You can see the little orange bars that represent what has happened in the last 3 days, where we've had the highest number of confirmed cases. On this next slide, let's quickly take a look at occupancy and availability rates. We had 96% notification results from the hospitals who are giving us information and notifying us. And this is for general beds, for patients who may have some sort of serious symptom, but they are not critical. And so you can see that represented here. We have 13,608 beds from the IRAG national network that are available. Here you can see by each state, you can see Mexico City, Baja California, Quintana Roo. Those have over 40% occupancy rate, which represents an increase in occupancy for beds. And on this next slide, you can see the availability of beds with ventilators, which are required to tend to patients who are more critical, with more complications, or who are having respiratory failure, so that they will need to be put on a ventilator. 55% is the national occupancy rate, and we can also see occupancy rates by state. That is my report for tonight. Thank you, Dr. Alamia. And now over to our governor. We have a presentation. Could you pull it up? Thank you. This is what we've been working on in Mexico City, and we've been coordinating with the state of Mexico, where we've been analyzing the metropolitan Valle de Mexico area. As you know, this metropolitan area is one of the highest density places on the planet. So it's hard to really take a look at Mexico City just by itself without looking at the municipalities that are surrounding it. There is this large urban area, so we have to have constant coordination with the government of Mexico, also hand in hand with the Ministry of Health. We are always looking at the number of patients who are intubated, both with our negative network by the Ministry of Health, and we try to work with the Mexican Social Security Institute, as well as ISSSTE, as well as hospitals from the government of Mexico and the government of the state of Mexico. Now, yesterday at 7 p.m., we just got today's information. We have 2,525 people not intubated in Mexico City, and we have 899 intubated in Mexico City. Next, please. In terms of the metropolitan area in Valle de Mexico, we have 3,372 who are not intubated and 1,034 who are intubated. And we are continuing to look at this. With an epidemiological monitoring model that we've been using with CONACYT and the Ministry of Health, we have different models from different research groups who are constantly and continually comparing information. The yellow is what we think could be a future scenario. This could be a prediction for people who are hospitals, who could be hospitalized. The blue is people who those are that's real information. What people who are actually being hospitalized. And here, these are intubated people. In the last couple of days, you can see that we have had slight growth from compared to what we had over the last week. It's not necessarily conclusive. This doesn't mean that we're flattening the curve, but we are trying to predict so that we can be consistent in what's going to happen over the next couple of days. So that we could have a statistic that really does show how the number of people who are intubated in the Valle de Mexico area is decreasing. It's not often that we talk about this, but this is very important. 2,214 people have recovered and have been released from hospitals. I'm not talking about people who have had to deal with their disease at home. I'm talking about people who have been released from hospital. And this is a good news. This is good news because we unfortunately have this. What's important is for you to see that 2,214 people have recovered. This is the information that has shown that we've had a little bit of a reduction in terms of hospitalizations over the last few days. I don't want to spend too much time. Yep, that's basically the same. And the last one is deaths, our very unfortunate deaths. Deaths by COVID in Mexico City. What do we do here? It's the same thing as happens in every state in the Republic. We inform the Ministry of Health of the government of Mexico, specifically the epidemiological area, the epidemiology area, and we tell them that this death has been attributed to COVID. Now, we have a series of guidelines that are established by the Ministry of Health of the government of Mexico that follow the WHO guidelines. There are other deaths as well, but there is a technical committee of scientific specialists who determine if their deaths are from COVID-19 or are not from COVID-19. And this is the same as happens in every other state in the Republic. So up to today, confirmed deaths by COVID in the city, we have this number. There are more deaths, but the deaths have to be determined to have been by COVID to be included in this number. The idea is to be transparent always with the information. And that's on behalf of our government, on behalf of the federal government. We're going to be transparent, but we're also going to be careful about the information that we release because we don't want to create furor over information that has not been scientifically proven. So that's available on the government, our website, our government website. It's COVID-19 City of Mexico. You can check that every single day. And that's the information that we also release in our daily press conferences. Thank you. Thank you, Dr. Sheinbaum, Governor of the City of Mexico City. Now, to wrap up that segment, I'd like to make a comment to all of you. I'd like to talk about methodology. Methodology in terms of epidemiological monitoring and in terms of death, and in terms of epidemiological monitoring for respiratory diseases. Let me locate you on the panorama. We had already commented that epidemiological monitoring is a process that looks at different sectors of the society And we have to mention that both local, national, and subnational governments recognize and identify. No, 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 not yet, please. I want to give them an explanation. So that they can identify health phenomena and what their determinants are in our population. So, in this way, we gather information, we integrate that information, we analyze it. That's the most important part in terms of epidemiological monitoring. And we get that information, and then we get recommendations for public policies, for programs, for actions. And we give those to the public, to the general public, so that they can understand this information openly and freely, and also so they can monitor or evaluate the actions that are being recommended from these public policies. That's a little bit of how epidemiological monitoring works. We have a very old national system for this. They come from 1898, 1891. It's a newsletter called the Epidemiological Newsletter, and it had a much longer name before. We've had constant evolution for our epidemiological monitoring. Our contemporary model, thanks, was worked on and updated in 1995 with things that have to do with technology and also with concepts that have to do with controlling diseases and public health. Other things, other parts of it have to do with epidemiological results and what they mean. And we also have to interpret these results to understand what they mean for Mexico. Let's focus on the information that we have on respiratory diseases so that we can put your worries at rest, so that we can ease you. And we want you to know, if you have concerns, they are all valuable. Somebody was asking yesterday about critiques. And you know what? Critique is always welcome. I'm so glad that there are people who are worried. And I was talking to colleagues in an interview recently, and we were talking about technical information. When it has to do with health, it's not always put into the public arena for discussion. Sometimes we just get little capsules of digestible information. But it's great that people are opining and having an opinion on sentinel surveillance and all of this. That's the best thing that is for the country. And it's great that the information is public. The epidemiological monitoring numbers are public, they're open. Any person can take a look at them and interpret them and analyze them. This graphic, what does it show? It shows death from flu and pneumonia by year. We selected to show you from the year 2000 to 2019. I want you to understand the letter R there. That means in review. That's because the statistics and the epidemiological monitoring information usually are under a process of review by a national body that is autonomous, and that's called the Institute of Statistics and Geography, and that is the official authority for vital statistics, which include, of course, mortality. So we have, when it's being codified, when it's being reviewed by INEGI, you can see that sometimes they want to tell you that they're going to be small differences up or down. The source is the general health information and our general health network, which is a system that is different from epidemiological monitoring, but that also shares information between them. 12,127, 11,222, et cetera, et cetera, et cetera. In the most recent year, which is still in review, 30,575. 27,112 that are from 2018. This is the size of the numbers of pneumonia, non-specific specified pneumonia. And what I want to also bring to your attention is that pneumonia is an inflammation of your lungs, normally infectious, and it can be lethal. The massive combination You can see here over these years, you can see that they're not specified. We don't know what the cause of death is because they didn't do a laboratory test, because the person died because they did a test, but the result was a failed result. It wasn't clear. There are many reasons. There is a massive, the majority, they're all registered as pneumonia in INEGI's information database. There are two specific causes. One is flu. I'm going to underscore some obvious reasons, like the flu pandemic in 2009. That's when influenza took center stage because it was diagnosed so much, because before it wasn't diagnosed as much. And we also see the influenza that has been attributed to these deaths. Now, pneumonia causes death because of different infectious diseases and elements, like all kinds of different stuff that can cause that. But the majority are not specified. There's a little sidebar here. Let's talk about atypical pneumonia. Atypical pneumonia is a clinical diagnosis. It's not a category for diagnosis for statistics or for epidemiological monitoring. Atypical doesn't mean that it's rare. It's actually very frequent. 50 to 20% of pneumonias present themselves clinically as atypical. And the reason why we use atypical, this word was invented when we didn't have modern methods for diagnosis, especially tomographies, x rays, so that we could take exact pictures of the lungs. And that's how we identified the typical pneumonia. And when we saw that there was a significant deterioration of the lung tissue and that it didn't correspond to what they saw on x rays. So the x ray of the thorax would tell us when did they have a difficulty, a respiratory disease. But this is not a diagnostic category that is within the International Classification of Diseases, and of course, not in Mexico either. So, the closest thing to atypical pneumonias are these non specified pneumonias. We're going to see the same thing that we saw, but we converted it into percentages for you. We had a number before, now we turned it into percentages so that we can show you the combinations of pneumonias in yellow and show you the influenza that is red. And then you basically cannot see anything that is the pneumonia is specified. Sorry, the influenza is what you basically can't see. These are all diseases of the respiratory system. All of this is more fatal. These are mortality rates. This is all fatal. These are all numbers from people who have very unfortunately lost their lives. So we can see a quarter and a third in most recent years from respiratory diseases that cause death. They were pneumonias. 96% of them were pneumonias, non-specified pneumonia. We'll see on the next slide where we will be concentrating on the yellow. We took out that gray that was below, which were other causes of respiratory disease death, death by respiratory disease. The great majority of these non-specified pneumonia, 95, 96% over the last recent years. And you can see 2000, 2001, you can see how it's non-specified pneumonia. And then 4% are pneumonia that we have seen from causes that are specified. The most obvious one, flu. Here we're going to concentrate on flu and the specific cause. For example, the little strips from the very top part of the last slide, you can see how flu in the years before our pandemic, it was not constantly reported on, and it wasn't diagnosed, it wasn't monitored. And then what we have after 2009, after the flu pandemic, is that we get a lot more notification of people saying these cases are flu. So that's what goes on with that sentinel surveillance system that we told you was established in 2006 and was perfected a few years before the flu pandemic, and that has continued to be updated and modernized all the time. Now let's focus on numbers again. but just what has happened so far this year. Let's compare it to a length that is equivalent to previous years. Let's talk about the cut up to April so that we can compare this to previous years. This way you can understand 2020, which is real time. This is the same information from the other slide, just that right here we've segmented them just for April. Here it says January to April 2015 to 2020. This is what we have for all of Mexico. This is Mexico City. Country, Mexico City, country, Mexico City. And this is what has gone on so far this year in terms of communicating notifications of deaths by pneumonia, non-specified pneumonia so far this year. The cuts are monthly, and I'm going to let you know what the dynamic is, how this works for monitoring mortality, which is different from monitoring the disease. And it's for a very basic, obvious reason. For our pandemic, we have to have real time information because the information is changing so quickly. Mortality by basically any cause doesn't change. It's a final piece of information that doesn't change. Are we interested in the statistics? Yes. Do we learn from them? Yes. Do we create knowledge for public policies for prevention, control, and development of our health system? Yes. But we do not need that information day by day by day. What we do need, for example, is occurrences of disease cases to see if the disease is propagating or not, if it's saturating hospitals, if we need preventive actions, et cetera, et cetera. Next. Here is a study that was published in a very prestigious international magazine, and it's called Clinic Infectious Diseases. World Infectious Diseases. We have Charo, this author, and then we have a number of Mexican colleagues, including Dr. Borra from the Mexican Social Security Institute, Dr. Ana Sofia Palacio from the National Health Institute, and other colleagues. Why do I show this to you? Because this demonstrates the dynamic of how people understand mortality in a severe incident, a severe event like a pandemic. And the most recent epidemic that we had in Mexico was the flu epidemic of 2009. When this pandemic occurred, the mortality numbers day by day, obviously they represented less. They resented less than the actual total. That's what happens in every country in the world. But after the pandemic was from 2009 to 2010, the flu pandemic. And then after that, this article was published in 2011. And it was an analysis that technically we call a retrospective, like with information that had been collected in the past in 2009 to 10. And they analyzed that information and compared it, as we saw with the bar graphs, to what had happened from 2000 to 2010. And basically, what this shows is that over 3 age categories, we have under 5 years old, people from 5 to 59 years old, and people who are older than 60 years old, and how it changes throughout time, how the death occurrence changes. We have a line here that is undulating in black, and this shows you what normally happens in blue. The line in blue is what shows you what happens during the flu periods. The black line is a mathematical prediction to see what kind of seasonality happens. The spikes are real information that was collected previously from the epidemiological monitoring system for mortality and our national health information systems. These are very interesting studies, and they demonstrate an increase in the mortality rate, especially for people between 5 and 59 years of age, which doesn't really look that impressive for people who are over 60 or under 5. This was a key piece of information for us for understanding H1N1 flu, influenza, because it showed the selective mortality among young adults and adolescents. That's normally what happens with flu, it usually happens in people who are older than 60 and under 5 years old. That's just a study, but I wanted to show you that here to see how we build knowledge for health. We're not just counting cases, we're not just counting deaths. We're interpreting them, we're modeling, we're analyzing them. And this is a process that has its own rules. And that, as we've said, and as Dr. Scheinbaum said, requires that we continue with formal procedures in order to have trustworthy statistics as well as appropriate analysis so that that can be interpreted transparently into useful information for decision making for public policy in health.
On this next slide, let me show you. There has been a recent concern of COVID cases in people who unfortunately passed away, and we did not get to test their fluids to determine the diagnosis. And the concern is something that we saw today on international press media is that maybe we are withholding information. But no, we have gone over this several times. We can gladly invite all those journalists from international press and media. You're more than welcome to come. We're always open for dialogue for you. In this publication that we have here, on this paper that you see on April 13, 2020, you can see the proper way to fill out the death certificate for COVID-19 SARS-2. This is a document issued by the Mexican government and the health ministry, and we specifically published it to incorporate information from those who unfortunately pass away due to COVID-19, and it's impossible to prove COVID through laboratory testing. We did turn to the Pan American Organization and the WHO, who are worldwide organization who define the codes to classify the diseases. Number 10, which is the one that's valid right now, that corresponds to COVID. We have the confirmed cases or the confirmed death, where we do have a laboratory diagnostic. Well, we also have the suspect cases that do not require laboratory confirmation, and the other probable cases where we do have evidence that the laboratory report for the virus was inconclusive, meaning that the laboratory failed to provide the correct procedure for evaluation, or the test sample itself was not correctly preserved. And all the certificates have been filled out following these guidelines, following also as well the COVID-19 disease, following these guidelines again. And as Mrs. Sheinbaum said just before, this is our country guideline. We do have technical committees that are specialized. Some of them are within the state and are the State Commission for Monitoring this disease. And we also have the epidemiological disease, which is by its initials CONAVE in Spanish. This next slide is for you to see that the surveillance is not a single database or a single platform or a single system. It's a multi-system. And when gathered together, they all put together the information so that we can have a bigger spectrum view of a more comprehensive and holistic health situation like the COVID-19 pandemic. We do have two systems, CISVER, which is a surveillance surveillance organization for disease. And the next one, which you might not be familiar with, is REDVE, which is a disease network by its initials in Spanish. And these are two systems that actually gather complementary information that draws information from the health unit and the different sanitary units, specifically REDVE, who are obliged to fulfill all sanitary requirements. And we do have documents that prove what we are writing in there. The two official documents are the death certificate and an attachment to the death certificate. The death certificate has different attachments in which you fill different details, and uh, and the different attachment, specifically number 8, has a ratification on the cause of death. We do have a specialized group of people that are actually named because they classify and codify. Their technical name is codifier. They get to establish the cause of the disease, and they use the international classification of disease. By the way, let me mention that Mexico, in its external report, do holds a collaborative organization with the WHO for disease classification. So what you see here is the information through time in the two systems that they not might match each other, and they don't necessarily have to match, and that's completely okay, because due to the notification cycle, sometimes they do get to match. And since we draw this information from different lines, since it's attachment number 8 and the death certificate, this is done electronically, and it's made digital so that the certificate is analyzed directly. Sometimes we only get to have the death certificate, but we don't have the attachment number 8, or the other way around. Or we might not even have any of those documents. On the total toll of deaths that you see on the right side of the screen, it's a little bit about over 260 above of what we usually say every day, and that is because they are waiting on the revision of their death certificates and our final decision on their cause of death. So please do not worry. Should there be any concerns at any given time, I will explain it once again. So now we're going to go to our question and answer round. So please, Bianca, I'm sorry we were left with you yesterday. Please go ahead. Thank you. Good evening. Bianca from Notimex TV. My question for you is, 2 days ago, you brought up that this situation has left a big gap with 307 hospitals. What's your opinion on that? If those hospitals had not been abandoned, or even if they were not left incomplete, otherwise we wouldn't be working on them or working on temporary hospitals. That's one question for you, sir. And Madam Governor, are you thinking about implementing any further action on our national market? Since you know tons of tons of markets are closing, I want to know if you're thinking of implementing different guidelines for this. Well, health is not a privilege, it's not a commodity, it's your human right, and it's integrated in the Constitution in Article 4 since 1984. And for it to become a real right, for it to be completely guaranteed, we do need a government action that will consistently guarantee at a personal, in terms of infrastructure, information, and governance, which are the main components of a health system. If we were to have such type of system with a worldwide connection and of free access, like it is in several parts of the world, like in Europe, Mexican health would be greatly benefited. That's my opinion. Regarding the national market, as you are very well aware of, this is the market that will provide food for not only Mexico City, but the regional center of the zone. We do have 90,000 employees there. It was very difficult to establish a safe distance. We wouldn't necessarily close it because we wouldn't be able to provide food, of course. But that's on the one hand. And on the other hand, based on the conditions that they regularly operate on, once we saw the contagion was growing, we did take different measures. What we chose to do was to limit the entrance of people, 2 people per car. We did have a decrease of 35% to the market, but that doesn't mean that they're no longer working. It's just that they keep working and people continue to shop, but they're just going in smaller numbers. We are increasing security with a face mask, specifically for those who are selling. And I would say that about for the past week and a half or 2 weeks ago, we have installed 10 and 450 health spokesmen and nurses from the Mexican government who are in charge to confirm the cases and to see who have they been mingling with and they have been confirmed. This way we can guarantee that we continue to provide food and take the correct measures. Thank you, madam. Please go ahead,
Gracias, jefa. Bueno,
Mrs.
por
Fernanda.
favor, adelante. Luego, Fernanda. Ya.
Gracias, Lisbeth Álvarez,
This is for
reportera
you,
del
Mrs.
diario Voz del
Sheinbaum.
Grupo Catán. Para
Starting
la jefa de
tomorrow,
gobierno, pues a
we
partir de
will be
mañana se va
having
a tener
this
esta
communication
comunicación entre los
with
familiares de
family
pacientes COVID
members of
y
COVID
pues saber en qué hospitales pues va a iniciar
patients. I would
esta
like to know how
videollamada
this is
y
going to work.
cómo va a ser la misma.
And my
Y
second
mi otra
concern
pues
is
pregunta o
in
inquietud,
San Andres
en el pueblo
Totoltepec,
de San Andrés Totoltepec, en la alcaldía de Tlalpan, se ha estado mencionando de
it
manera
has been mentioned
constante
that there
que
are
hay
several people
varias
infected with
personas
COVID
infectadas
19
por COVID
are,
y que no
and are
están
not being
recibiendo
treated.
esta atención.
What's your
Quisiera
report on this
saber qué
situation?
informe se tiene ante el caso, por favor, y gracias.
Well, of
Sí,
course.
cómo no. Em, en el
So,
caso
when
de
talking
la
to
comunicación con
patients, we
pacientes,
have installed
instalamos
11
hasta ahora
tarps.
11
There are so
módulos.
far only in
Por lo pronto están
the
solo en los
hospitals
hospitales de la
in
ciudad,
town,
algunos que están
those
determinados
who
como
have been
COVID
assigned as COVID
y
19
otros que
treatment
no, que son
centers, and
generales, pero no están en
others,
este momento como COVID,
because we're taking
porque se están
different
tomando
measures
una
in
serie de
order to
medidas para
let
el ingreso
the
de los
family in to
familiares.
see their patient. These
Estas
were
se
installed
instalaron
3 days
hace
ago.
3 días
Family members
y
can actually
los
go and
familiares pueden
ask,
llegar y
and
preguntar.
we
Y
are
estamos colaborando para que
cooperating
se
so that
instalen
this goes
también en los
into
hospitales del
our
INSS y
government
los institutos
hospitals
nacionales de
and the
salud y los
hospitals that
hospitales
do
generales de
rely
dependencia
on
de
our
Secretaría de
health
Salud.
ministry.
Y a
And
partir de
starting
mañana en
tomorrow,
estos
in
mismos
these particular
hospitales
hospitals, we have
ha
received
habido
important
realmente
donations from different
donaciones muy importantes
corporations.
de muchas empresas,
And, we have also
desafortunadamente
had
otras
so,
que no
so,
se han
so
cumplido
many
de
others that
mejor manera,
haven't
la gran mayoría lo
responded
ha
the
hecho
same
así.
way, but
Y ha habido
fortunately,
muchas
most of
donaciones
them
y
have.
tuvimos
So we
donaciones
do
de
have
teléfonos y
phones
tiempo aire,
and
y eso
cellular
nos va a
time
permitir
so that
que
they
pueda
can
haber
communicate
comunicación
between
entre el
patient and
paciente y la
family.
familia.
This will
Entonces a
begin
partir de
tomorrow,
mañana va a
and
comenzar y se va a
we
ir
will work on perfecting this
perfeccionando este
process.
proceso
And we are in
y hay
communication
comunicación
with
entre
those
los promotores
spokesmen
del
that are
gobierno de la ciudad
outside
que
of
están fuera de
hospitals,
los
and of course,
hospitales y
the
obviamente el personal
social
de salud,
workers, nurses,
trabajadores
and
sociales y
doctors who
enfermeras que
are
están
working in
trabajando
this
en esta
campaign who
dinámica
can
para
support
poder atender a los
our patients who
familiares que
have
tienen
family
personas en
outside
hospitales
waiting
de la
for them.
ciudad. Así
I
es.
actually lived in San
Conozco
Andres for
bien San
30
Andrés,
years,
viví ahí 30 años.
so let me
Vamos
look into it. I
a ver
do know
exactamente qué
that
es
there
lo que
are
está
some
pasando.
cases and
Conozco de
some
algunos
unfortunate
casos
recent
de
deaths,
fallecimientos
but we
recientes
are reaching
y
to their
estamos en
local
contacto con
government
las alcaldías. Hay
so that we
una
can
coordinación con las 16
take
alcaldías de la
action on this.
ciudad,
Let me
pero no
focus on
sé en
this if there's
particular
anything that we are missing
algún
to do
tema que
in
no se
San
haya
Andres.
contemplado en San Andrés.
Gracias, doctora Sheinbaum. Fernanda, Carlos, Araceli.
Good afternoon. I work for
Buenas
Glucosa
tardes.
Atomica.
Para Glucosa Atómica, diversas figuras públicas del país, no conformes con
Different
demeritar el
agencies in the
trabajo que
country
hacen
have tried to
ustedes,
disqualify
han
you as
tratado de
well,
descalificarlo también.
even for the
Aquí
people
mismo en
who
este
join
recinto
us right
incluso.
here in this room.
Ahora recurren a medios
You
internacionales.
continuously say
Usted
that this
explica
is
que es libertad de
freedom of
expresión,
expression, yet they
aunque
are
son
disguised
claramente ataques.
and
Mencionaba
as
también que ha
such, but they
acompañado
are clear and
grosamente a
open
intereses
attacks.
políticos involucrados
What
en
do
todo
you think
esto.
are the
¿Qué
interests
intereses
behind
hay en
this?
todo
Is
esto?
there something that the
¿Hay algo
citizens
que los ciudadanos no
are
sepamos y debamos saber?
unknowing of and we
Otra
should
más, si
know?
me lo
Next
permite, los
question, for the
pacientes que se van
patients
recuperando de
recovering from
COVID, ¿qué
COVID-19,
indicaciones deben
what
seguir?
instructions
¿Se
should they
tendrán que
follow? Should
realizar
they be
alguna prueba
retested?
después de cierto
And
tiempo?
then you
Y
said
añadiendo a esto,
yesterday
usted dijo
that
que nos iba a dar otra
we were going to
explicación
be
sobre las
informed
pruebas
on quick
rápidas el día
testing.
de ayer.
If you can
Gracias.
recap on that,
Gracias, con
please.
mucho gusto.
Well, on international
Sobre los
media
medios
and their
internacionales,
interest,
los
let me be
intereses.
clear
Debo
about this.
dejar muy en claro
The 3 or 4
los
papers that
3 o
actually
4 periódicos que
printed something
frecuentemente
on this
relacionados
topic,
temáticamente
I
con este
have
tema,
no
no
prejudice
tengo
towards
prejuicio
them.
alguno.
They are
Uno
an
lee
international
medios, en
media,
este caso
and to
internacionales,
read
y siempre es
papers
bienvenido
about this
leer
is always
reportajes,
welcome on
entrevistas,
my
notas.
end.
En uno de ellos
However,
me
I
llamó la
did
atención
notice
la
lack
ausencia
of
de rigor.
discipline
Siendo
because
que
actually
en general
I'm a
aprecio,
subscriber
estoy suscrito a
to this
este
particular
periódico
paper,
y me
and
llamó
I
al ver
saw a
una
particular
noticia que un
headline
poco
that doesn't
desentona
quite
con los
go with the
estándares
tone of
periodísticos de
our
este medio
context, the one talking
y que
about
habla de
death
mortalidad.
tolls. And when I
Y
meant about
cuando
interest
me refería a los
in what I
ingleses, el único
presented
video
earlier this
que
afternoon,
presentamos esta
is that
tarde
what
es que lo que
catches
me
my
llama la
eye,
atención, pero no
it's
creo que
something that
esté
is not necessarily
articulado
connected to the
con los
media,
medios,
but
es
how there is a
como
segment of the
hay un segmento
population
de la
that I do
población que
identify as
identifico
related to the
relacionado con
political
la teoría
action,
política,
certain parties that are
de los
looking
que están por
to get
quererse
registration and
registrar,
why
los que
not.
quieren
And
posicionarse,
so they
que
take
toman
every single thing that comes out
cada
to
cosa que
drive it
sale
in a
para
political way. And
orientarlo
I've said it before
políticamente.
and I will
Aquí hemos
say it
dicho
again.
una y otra vez,
This
lo
is a
volvemos a
technical
decir,
forum.
este es un
This
foro
is a forum
técnico, este
for
es
us
un
to share
espacio para
information
compartir
towards the
información
society
hacia la
directly and
sociedad a
towards
través de
you so that
experiencias
we
de vida
can
directa,
gather
para
from the
recibir de la
society your
sociedad
concerns and
también
your questions so
inquietudes,
that we can work
comentarios, dudas
together,
y
which
poder
is
trabajar
common
juntos por algo
interest.
que es
We
del
did
interés
mention it
común.
at the beginning. The
Dijimos desde el
president said
inicio, lo
so as
dijo el
well, and
presidente,
we said
lo
it with
dijimos
all your
todos sus colaboradores,
peers.
es muy
It's
importante
important
que
that
una
this
epidemia
pandemic is
se
handled
maneje
technically
técnicamente,
and scientifically
científicamente,
so that
para que
political
los vaivenes
highs and
políticos que
lows
irremediablemente
do
existen en
not
cualquier
disturb
sociedad
the
no
clarity of the
perturben
message that we
la claridad de los
communicate and
mensajes
that are
que se
based
transmiten
in
y que están
technical
basados en
and
técnica, en
scientific
ciencia y las mejores
recommendations.
recomendaciones
That's what caught
internacionales.
my eye
Entonces, esa fue lo
from
que
that
me llamó la
particular paper.
atención
Now, in
verlo.
terms of the recovery of
Sobre
patients, so as Dr.
recuperación,
Sheinbaum has just
como
mentioned,
bien
it's
señala la doctora Sheinbaum, es
encouraging
muy
to see
alentador
that the
ver
patients
que los
who have
pacientes,
been
las personas
hospitalized
que son
are
pacientes
being recovered. I
hospitalizadas
find this
se
extremely
recuperan.
valuable
Y esto me
because
parece
not
muy
only the
valioso porque
mild
no
cases,
solamente los
but
casos leves,
the
los
great
casos
majority of
pediátricos,
cases with the
también hay
data that
una
we
gran
just
cantidad,
saw,
lo acabamos de ver
there's
con el
a
dato de la Ciudad de México,
significant
de
number of
personas que
people who
salen del
actually
hospital,
make it
salen
through
bien, salen
and
con
they are
vida, salen
released.
recuperados, en algunos
They,
casos
they might
salen
be weakened,
debilitados,
not
estamos hablando
physically
de debilidad,
weakened because they have
de
been
los
lying down
músculos
for a
por el
while,
reposo
but
prolongado,
maybe
sino
with,
incluso con
some breathing
algunas alteraciones de su
troubles.
capacidad
And
respiratoria,
they
pero
will
en su
get
momento
better as
se
time
irán
goes by,
recuperando a
depending
tiempos
on
reales,
how
de
much
acuerdo
damage was
con
done and
el
how
grado
much
de
they stayed in the
daño, la
hospital
duración
and
de
their general conditions
hospitalización
when they
y
got
sus
sick.
condiciones generales
But
al momento de
specifically
enfermar. Ahora, respecto
on
a
your
la
question
potencial
on the potential
importancia
epidemiological
epidemiológica,
degree, after
hay que precisar,
14 days,
después de
even
14 días,
the very
aún
severe
los casos
cases,
graves
it would be
ya
very weird, but
prácticamente es
it's very
muy,
weird
muy
that they
raro
would have the
que
virus
mantengan
active
el virus
in their
activo en la
breathing
vía
system, so they
respiratoria
won't
y
be
ya no son
contagious.
personas que contagian.
And the testing, I
Ahora,
will
yo creo
put
que
that
vamos a
on
estar
hold so that
pendientes de
I
las
can
pruebas para
delve
poderlo
into
explicar
it
con mayor amplitud.
fully.
Carlos
So
Araceli,
you and
usted.
you next, please.
Pues usted.
Dr.
¿Qué
and
tal,
Dr.
doctor?
Sheinbaum
Doctora
and Dr.
y,
Lumia, good
y doctora
evening.
Lomía también. Buenas noches. Tres
Mrs.
preguntas
Sheinbaum,
rápidas para la jefa de
what's
gobierno.
your
¿Qué
opinion
opinión le
on
merece
this
en relación
particular
a este
paper
artículo que,
that
bueno, estos tres
are
artículos que
published
salen en la mañana pasada
internationally
mencionan una
that
discordancia
show
entre los datos
discrepancy
que
with the
presentan en el
numbers
caso de
of
la Ciudad de
Mexican City and
México
their
y
federal
a nivel
numbers?
federal?
That it
Salvo
might
un
have
caso
been a
que hubo por ahí
typo,
un
but
error de dedo.
us who follow these
Seguimos las
conferences,
conferencias también de la
who
fuente
continue to
calificada que tenemos
follow
ahí
this
a través de
particular
Mario Delgado
information,
Independientes
we do
de
not
Estadística
see
Global
a
del ISTE.
mismatch.
No
What's
vemos
your
ninguna
opinion?
discordancia. ¿Qué
My
opinión le
second
merece
question
esto? Y
is,
la segunda para usted, ¿cuáles serían las alcaldías que saldrían primero de
you're
esta
planning to do a
desescalada que
particular
se, bueno,
step
que tomaría esa
by
desescalación
step
que el presidente de
program,
México en la mañana
and you
comentaba que
said that we
podría
might
durar este
expand
periodo de mayor
this
contagio hasta el día 20,
quarantine
no nada
toward
más para
the
en
20th of
octubre.
May. So what
Sí,
are the first government
siempre
offices
bienvenido
to go out of this
debate
problem?
científico
Well, I always
y el debate
welcome
político.
political and
Eso
scientific
siempre es
debate.
bienvenido,
That's
estamos en una
first and
democracia
foremost my first
y
statement.
en la ciencia pues
And
tenemos
this is a
fundamentación el
democracy.
debate, si
Democracy
no, no
will
sería
involve
la investigación científica.
scientific and political
El tema aquí
conversation.
es cuando lleva
So
pues
sometimes I
algún
feel that
otro
when this is
objetivo.
mixed and has
Entonces
a
ahí
different
cada quien
objective, that's up to
la
you.
opinión
That's
que
your own
tenga.
opinion.
No, no creo que
And,
en este
you know,
caso y que cada quien haga
you
su
should do your own review
revisión de acuerdo
based
con
on
lo que
what you
se
see
escribe
on
en los medios de
your
comunicación.
media
Bienvenida
of your
también la
preference.
libertad de prensa,
And,
es fundamental en nuestro
freedom of
país.
press is welcome in this
En el
country as
caso de
well.
la desescalada, aquí
Based on your release
hemos estado en
program that you
comunicación
mentioned,
permanente
we have been
con,
in constant communication not
no
only with
solamente con el
Dr.
doctor
Getzel,
López
but
Gatel
also with
de la
the Health
Secretaría de Salud,
Ministry
estamos en
and the
coordinación
Economy
con la
Ministry
Secretaría
with
de
the different
Economía, que
credits
justo
that are
ahorita se
being
está
released
dando en la
in
Ciudad
the
de
Mexico
México.
City. Not
Hay
only
una
is there
coordinación permanente.
political
Además de una
affinity, but
afinidad
constant
política, hay una
coordination.
coordinación
And if
permanente.
more
Y si
coordination is
tiene que haber
required, is
coordinación
right
en
now.
algún
We cannot afford by any means to fall into miscoordination and to use this epidemic in a political way. Our interest is to save lives and to have enough available beds in hospitals and to generate enough preventive actions that with our safe distance, we get to stay home and stop contagion not only in the city but in the country. So we will always be coordinated. Specifically during this time, there has to be so that we can reach to our
tener a la
citizenship.
ciudadanía. En el caso de la apertura, hay un
There's
comité del
also a
gobierno, en esto
committee
también hay coordinación, hay un comité del gobierno de México que está trabajando
on
sobre
how we can start
cómo ir
opening the
abriendo la
economy and the
economía
different social
y las
activities in the
distintas
country.
actividades
As you're
sociales
well
en el
aware
país.
of,
Como
the
ustedes saben,
Mexican
la
city
zona
is the one with the
metropolitana de
highest
México
contagious
es
rate.
ahora la de mayor contagio.
And based on the condition that we
Y
have,
de acuerdo
we
con la
will have a
información que tenemos,
reopening that
pues
is
va a haber
being
una apertura que
coordinated
está
by the
siendo
Mexican
coordinada por el
government and
gobierno de
in which
México y que
we are
nosotros
participating as well.
estamos
We will
participando. Ya
have
va a
the
haber
time when the
tiempo
time
en
is
su
right so that we
momento
can address it
para
properly.
poderlo
But
atender.
for
Por lo
now,
pronto,
is to stay at home,
pues es quedarnos en
implement
casa,
your safe
la sana
distance,
distancia
and keep this
y
condition
mantener esta condición para que
so
esta
that
posibilidad
we
que
can
hemos
retain this
tenido de
condition
darle
to
una
make
cama a
sure
los
that there
pacientes,
is
a
a
todas
bed
estas personas
available
que se
for
enferman
those who fall
gravemente
into
por el
COVID-19
COVID-19, tengan la
disease, be
posibilidad
able
de
to be
seguir
attended.
atendiendo. Ese es mi
Y la
comentario.
última para el doctor Gabriel, que manejan las cifras del diario de este coronavirus.
At a national
Al
level,
final
the
de
president
semana, esta
said
fecha que
that
da el presidente López
by
Obrador
the
para llegar a México,
20th
que es el
of
20
May, we
de
might
este
get
mes,
to
de
the
que se
highest
pueda
peak of
concluir ya el
contagion.
pico de
Is that
contagios.
correct,
Algunas ciudades lo
national-wide?
está haciendo, que ambos nos decían que
Based on the fact
Cancún,
that you said that
otras ciudades
Cancun
están
and
a
other
punto de
cities
salir
are
de este punto rojo que
very
le podríamos
close
llamar, o
to
yo le
leave
llamo
the
el día D,
D-Day,
de salir de este día D de los
do you
contagios.
think
Se
that this
planea que
date
también
may
se pueda
be
recorrer este tipo de fechas
pushed
para la
forward
desescalada, como dicen
or
en
to
España, o la
be, put,
apertura o el
do you
regreso a la
think that
normalidad,
this
como
date
decimos en
might be
México?
pushed forward so
Pues
that we
muchas
can
gracias, Carlos,
reopen
por la
again,
pregunta.
even if
Efectivamente
it's
es
on a controlled
importante.
stage? Well, thank you
La
for that
epidemia
question.
de
Well, just
COVID,
like
lo
we
mismo
did
pasa
with
con la
the flu
influenza y lo mismo pasa
and
con
any
varias
other
otras
disease that
enfermedades
can
de
be
interés
categorized as
epidemiológico,
epidemiological, we
no
don't have a
es
single
una sola curva
epidemiological
epidémica.
curve.
En los países
In small
pequeños,
countries or small cities where
donde hay
we do
además
have
mucha densidad
lots of
poblacional
proximity and
o
density in
proximidad
terms of
física entre las
citizenship,
ciudades, por
we might
ejemplo,
be able to
puede
synchronize an
sincronizarse la
epidemic
epidemia
in a single
en el
territory.
territorio.
But countries that are as
Pero
big
en
as
países
Mexico,
extensos
Brazil,
como
the
México,
US,
como Estados
Russia, and
Unidos, como
China,
Brasil, como
it is
Rusia, como
as if
China,
we, or
es
the
como si
India for that
fueran,
matter,
o la
it's
India,
as if
es como
there
si
were many
fueran
countries
múltiples países en el sentido de que
where
cada
every single
ciudad,
state
a veces
represents
cada
an
estado,
epidemic in itself,
sincroniza una
but
epidemia
the
por sí misma,
current
pero
state
es diferente
changes
las
from
fechas
one
de
to
ocurrencia
another.
respecto a otras.
So
Entonces, por
again,
eso
as
hemos
a very
comentado,
good news,
de
we
hecho,
have
como una
labeled it
muy
as
buena
such.
noticia esta
It allows
dinámica,
us to
porque nos
focalize
permite
our efforts
enfocar
in the
esfuerzos
top
ahorita en
five
las
cities
cinco
who
ciudades
have their highest rate
con mayor
contagious rate:
intensidad de transmisión:
Mexico,
la Ciudad de
Villahermosa,
México,
Tabasco,
Villahermosa,
Cancún,
Tabasco,
Sinaloa, and
Cancún,
Tijuana.
Culiacán, Sinaloa y Tijuana. Y en la medida en que estas cinco ciudades, muy próximamente también la Ciudad de México,
As
van a
long as
empezar
we
a
get to
tener
have
menos y
small,
menos y
small
menos y menos
cases,
casos, cuando lleguen a un momento que
whenever
precisamente
we
nos
reach
refería el
like by the
presidente,
20th, as the president
alrededor del
said,
20, ya
we
vamos
will
a
have
poder
the
los
resources
recursos que se
available
utilizaron aquí
for other cities
también
and
ponerlos a
other regions
disposición de
that
otras
might be
ciudades
in need
y
to get them.
regiones que
And
pudieran
this
tener
particular
necesidades.
work has
Y
been
ese
done, as
trabajo lo
Dr.
hemos
Sheinman has
hecho, como bien señala la
mentioned
doctora
already. We have
Sheinbaum,
done it in
en perfecta
perfect
coordinación
collaboration
con las
with
entidades
the different
federativas,
states,
no
not
solo,
only
aunque es
with
destacable,
Mexico City, but
con la
the
Ciudad de
rest
México, pero con las
of the
32
states as
ciudades,
well, so that we
entidades
can have
federativas,
a
de modo que pueda
solidarity
haber un
team
esquema de
throughout the country.
solidaridad
And I
de
find
todo el país.
that this is the
Y aquí
key
la
word:
palabra clave es esa: solidaridad,
cooperation
cooperación.
and solidarity.
Cuando vayan disminuyendo
When
las
the bed
ocupaciones
occupancy rate
hospitalarias,
may be
terapias intensivas,
lowered
puede
and
ser que
all
los
the different
recursos
resources
útiles,
be lowered, not only
incluidos
material
los equipos
resources, but
profesionales, no
other
solamente los
types of
recursos
resources that can
materiales o
be made
tecnológicos,
available to
pueden estar
support
al servicio
other
de
cities, other
apoyar
regions, and other
otras
states that,
ciudades,
at
otras
some
regiones,
given
otros
point
estados que
may
pudieran
be
en su
in need to
momento
get this
tener
support.
este grado de necesidad.
Araceli,
Gracias.
and then
Araceli, por favor,
you
creo que
last.
va a ser la penúltima y
Very
cerramos.
quickly,
Ay, rápidamente, gracias, doctor.
Dr.
Preguntarle
Sheinbaum,
primero a la jefa de gobierno si en vísperas del 10 de mayo habrá algún
upcoming day
operativo
of
para
Mother's
persuadir a
Day,
las personas
is there
que
any
no
particular
salgan de sus
initiative
casas, que
to
no acudan a
foster them to
pastelerías,
stay at
a
home,
los
not
mercados
to
de
get
flores?
cakes or
¿Habrá
flowers?
algo
Is there
para
anything that you're
persuadirlos de
thinking
que
about to
permanezcan en sus
persuade them to
casas?
stay at home?
Preguntarle,
And Dr.
doctor
yesterday, you
Gatela, usted
spoke
hablaba
about
ayer de la inmunidad de
something
rebaño.
of
¿Qué
flock
implicancia
immunity,
tendrá esto
and this was
precisamente
a
para la apertura
program.
escalonada de
This
los
was something
municipios?
thought for a program of
Doctora Goya, si me
reopening
puede hacer el
for a
favor de decirme
particular state
cuáles son
and
los municipios
municipality. Can you
con
mention
menos
what are the
casos de
municipalities that have
COVID
the lowest
en
COVID contagion rate? Okay, well,
Con
on
el caso
Mother's Day.
del 10 de
So
mayo
in the
en
city,
la ciudad
we have
hemos optado en todas
mentioned
las ocasiones y además por la vocación democrática de nuestra ciudad es que
we
no
haven't
hemos optado
necessarily
por una
chosen
opción en donde se multe a las
to put a
personas que
fine on
están
people who are
caminando en la
walking in the
calle.
street,
Eh,
but the other way
Habrá
around. We have
veces
thought that we should
concientizar,
increase
informar
awareness
y
on
la
this,
verdad es que
and
ha habido
we
una
have had
cooperación muy
operation, and we're looking to get that to operation on May 10th. They do know that the best way to celebrate your moms and your grandmothers, our mom, is to keep our health distance. For this particular Mother's Day, we might be able to celebrate with our health distance. We are going to have an all-day festival. We are looking to hire mariachis are unemployed. The government has been employing them. We did some videos, with your health distance and why not, so that they can serenade throughout the day, um, to all the moms out there. And we will have a new day to celebrate, maybe July 10th, which is our proposed date with the different restaurants in the city, so that we can again celebrate them in their day. This is a call to action to our citizenship to be responsible. I have always said this: governments have a huge responsibility, and we are not eluding this nor the information regarding it. We do give the information in its proper time and manner, but the citizenship is sharing this responsibility with us. So I'm hoping that you guys are going to be responsible on this coming Mother's Day. Okay, about flock immunity, and we could also have a specific session for it, but this is a phenomenon that occurs in the different cities where resistance to the infection that it comes from the immune system, hence the immune response, within a specific group of people, that they don't have to be 100% of them, but it's big enough so that there is no further contagion. That's why it's called flock immune system. It's just like a flock. Or, like penguins who protect themselves from adversity by grouping themselves together and creating a protective barrier. So in this case, the particular mechanism goes as follows. So if I have some people who are immune, and my relationship is mainly with immune people, if I was infected, I will no longer infect anyone else because my surroundings are composed of immune people. And the contacts for those who are immune will no longer carry the virus again. Transmissibility of this particular virus is measured by the number of population that needs to become immune so that the immune flock phenomenon occurs. In a particular case like SARS-2, which is the creator of COVID, we are talking about 60 to 70 and some others even up to 80% of the total population to become immune. This is all in the hypothesis that has not been scientifically proven that the infection created of SARS-2 may create immunity, and that immunity is protective, and that immunity is long term. And my last thought on this: how many cases do we have? How many contagions do we have? Some other papers in Spanish actually published something on this topic with the hidden cases, or was talking about like 730,000 contagions. That's good, for as long as those are not people with a severe disease. And we know that they are not, because severe disease will be already monitored 100%. We do know from the very beginning that there is a big number of the population that I hope that you stay at home, that if you are not a person with any risk factor, your age, your pregnancy state, please do not go to the ER or to the hospitals, because you might transmit the virus. Individually, you might just have the question lingering in your mind: did I or did I not have COVID? I only had a fever, sore throat, but it won't scale any further. And at some point, which is one of our intelligence methodology, is our surveys on the topic. When we talk about this immune flock phenomenon, we'll talk about the survey, but this is looking to put in paper what is the percentage of the Mexican population that do have an immunological barrier, and see if we can actually reach the critical point of the flock immune phenomenon. So we will have to have a percentage of this phenomena to reopen different ministries, processes. Well, not really. We don't have these validated nor authorized by COFEPRIS, precisely because we still have scientific questions on how to
los
correctly interpret
picos,
the
las
different
concentraciones de
concentrations of
anticuerpos.
antibodies
Pero cuando esto ya
and
se divide
others.
en
So
algún
when
momento
we do
habrá
have it, and this will
mayor
be
conocimiento del
larger knowledge
mundo,
around the world,
entonces
we
podremos tener
will use
pruebas
them
serológicas, las
to
podremos usar para
follow
documentar
what's the
qué
percentage of
porcentaje
immunity,
de
and that
inmunes
will
existe
contribute to
y
our decision
contribuirá a
taking.
las
It's
decisiones,
not a
pero no
key
es el
element
elemento
so that
indispensable
we can
para
decide
tomar la
whether
decisión
to
de abrir
open or
o no
not
abrir los
certain
municipios. Gracias,
municipalities.
Araceli.
Rápidamente, nada más
And
en
to answer
relación
your
a la
question
pregunta de los
on the
municipios con menos
municipalities
casos,
that have
municipios
very
con
few
menos de
cases,
3 casos
the ones that have
confirmados o
less than
detectados
3,
son
I would say
más de
that there
100.
are below
Les voy a
100,
dar ahorita el listado
but
completo,
that's
pero
no
no hay problema
problem.
porque miren, les
Please, I
invito
invite you
en
to
el
visit
micrositio de la
our
página de la
website,
Secretaría de Salud.
which is
Si
called
ustedes entran al micrositio,
a
en
microsite.
la
You
pestaña de
have
arriba hay un
a button
enlace
that
que
says
dice
data,
datos,
and if you
seleccionan
click
datos
on it, it
e
will
inmediatamente
redirect
los va a
you
mandar a la
on the
página
page
que
that
se está
we are
trabajando de
working
manera
with
conjunta y coordinada
CONACYT.
con CONACYT.
There's
También
a
las
map.
opciones de la
You
izquierda dicen
select the
mapas,
map. You select the
seleccionan el que
high
dice
definition
mapa
map, and you
HD,
will
que es
see
de alta
the
definición, y
map
les va a
that you see on
aparecer
the
este
screen right
mapa
now,
en donde
where
pueden
you
ustedes
can find
encontrar
all the
todos los
municipalities across the
municipios del
country,
país
and we
y
have
en
them
ellos
color
están
coded
marcados
for the
con un
municipalities
color
who only
para
have
los
one
municipios con
case,
un caso,
3,
con
or 9,
2 casos, con 3 y
knowing that
menos
this is
casos, con la
interactive.
ventaja que es
So when
interactivo.
you
Al
click
momento que
on the
ustedes le
municipality,
dan
it
un
tells you
clic
how
al
many cases they
municipio,
have.
les dice
This
cuántos
is
casos se
an additional
encuentran,
way to
y
find
además, como ustedes
how the
pueden notar, como la
information in
información
Mexico
en
is being
México
done
se da
transparently,
de manera
clearly, and
transparente,
openly.
clara,
This is
abierta,
open for
y
anyone
todos
who
pueden
wants to
entrar y
check it out.
consultar los datos
Thank
sin
you
ningún
very
problema.
much.
Muchas
It's 8
gracias.
o'clock
Quedará pendiente, son las 20 horas.
exactly. Your next
Muchas
questions will
gracias,
be put
doctora
on hold.
Sheinbaum, doctora
Thank you very
Lomelí.
much. We'll see you
Seguimos
tomorrow.
pendientes, nos vemos mañana. Gracias. Muchas gracias.
Jesús.